The coronavirus death toll in Spain has jumped 30% in the past 24 hours. 209 people have died, taking the country's toll to more than 760. The number of infections has now passed 17,000 compared to just 13,000 yesterday. Now, Spain's intensive care units have been overrun with patients. Preparations are now underway for a Madrid hotel to be used for non-critical patients. And as the number of cases across Europe surges, a team of experts from Oxford University is urging governments to experiment with using a mobile app for instant contact tracing. For a closer look at how this would work, we're joined by Professor Michael Parker from Oxford Nuffield Department of Population Health. Professor, thanks for joining us. I want to get your take on the current situation in Europe. Now, we've seen infections spike over the past week. Why is this the case, despite, as we're seeing, this harsh lockdown measures, all over the place?
Good evening. Yes, you're right. The situation is getting worse, and certainly is in Europe. The ultimate cause of this is social contact, and despite the lockdowns being an important measure, they're not capable of dealing with this totally by themselves. Part of the problem is that because around 50% of cases are caused by transmission when people don't have any symptoms, what that means is that normal approaches to public health, which involve identifying someone who's got symptoms and then following up their contacts, those don't work, because by the time you've made contact with a person with symptoms, the transmission has already happened. So, and another reason, of course, is the scale. So what that means is ultimately we're using rather blunt instruments to address this, and our argument and what we've been doing is to try to develop a way of doing contact tracing which is much more instantaneous.
So, Professor, on the point of the contact tracing, it has proven to be very important in terms of mitigating the spread of COVID-19. We use it here in Singapore. We get the local authorities involved. We've got ministries involved as well. You're recommending the use of a mobile app to do the same. So how would that work?
Well, firstly, apps have been used in other settings, and one of the issues for us is there a way of doing this in a European setting in a way that would be, and possibly in other settings too, which would be acceptable. So the idea here is that the app would essentially be a traffic light system, and most of the time most people would be green, and that would mean you could get on with your normal life. If you were out, imagine you were out having a meal with some people in a restaurant, and a couple of days later someone who'd been there tested positive for COVID-19. Then the app would essentially send a signal to all of the people who had significant contact, so maybe people who've been within 5 meters for more than 15 minutes, something like that, and that would be done anonymously. So your traffic light on your phone would go from green to red or amber, depending on the level of the risk, and if it went to red, you'd then be advised to self-isolate. And the advantage of this is, firstly, that it's a kind of intelligent social distancing. One of the problems we have at the moment is we have a very blunt tool. Everyone is social distancing. Not everyone needs to be, but we're not able to tell the difference between people who do and people who don't need to do this. So that it would be intelligent in that sense. The other thing is that this would be something that people could choose to download on their phone or not. Of course, we would strongly encourage people to do that, and there would be lots of efforts by government and so on to get people to do that. But our estimate is that you wouldn't need everyone in the population to download the app for this to be successful. So there's an element of choice. People who are worried about their data could choose not to do so.
Right, Professor, so you're talking about this app being intelligent, and there is that element of choice, but how efficient would that be compared to the current contact tracing methods, though?
Well, there's one sense in which it would be much more efficient, which is the speed. So this would be, instead of contacting people, which takes days, and then finding their contacts, this would be instantaneous. So in that one sense, it would be very much more efficient than the current system. There are technological issues, so technical issues that need to be addressed. So those would include, for example, one way of doing this would be to use Bluetooth. And most mobile phones, I'm sure in Singapore, most mobile phones use Bluetooth, but there are people in many societies that would have phones that are not able to do that, or it would require a lot of battery life. And of course, the worry is that some of those people would be some of the most elderly, some of the most vulnerable in society. So that solution might work for some, but we're in the process of developing other solutions that would be more effective and be useful by more people. So there are some technical challenges. One possibility is, as in China, they've used QR codes, for example, when people go into the underground train. There may be ways of using that kind of method, but that's in development at the moment.
All right, thank you so much for speaking to us. We've been speaking with Michael Parker there, Professor Michael Parker of Oxford University.